Story 1. An elderly man fell at home and lay there for a few days before someone found him. He had no family and no living will or advance directives that could be found. He was covered in pressure sores from lying on the floor when he was found. His teeth were badly decayed, and he lost a few during intubation. His mouth was a bloody, gory mess. This contributed to his poor nutritional status and weakened skin. He was severely septic and in respiratory failure, with no one to speak for him. He tried to pull out tubes and had his hands restrained. He was lucid enough to resist being cleaned and turned. He looked miserable and was in constant pain. I've never seen a person's mouth stay so wide open for so long. We had to perform oral care every 4 hours to prevent pneumonia, and he would shake so hard from the pain no matter how gentle we were. His sores did not heal despite a pressure-relieving mattress, and immobility caused swelling and weeping of fluid. Eventually he died. I think about him often. A man who spent his last weeks restrained and in pain because he had no family or legal documents to guide his care. It was obvious he would have preferred palliative care, but he could not communicate and there was no legal way to de-escalate treatment. A coworker visited at first but eventually stopped coming. I cannot blame him. If you or your loved ones have medical documents, such as a do not resuscitate order or advance directives, put a copy on the refrigerator in a labeled envelope. Emergency medical technicians will look there for such documents. If they do not find them, having them elsewhere may not help. Story 2. I am not a nurse or doctor, but I am a phlebotomist at a hospital that has many psychiatric floors, and the emergency department is about 75% psychiatric cases. We see drug overdoses, both intentional suicide attempts and accidental overdoses, mental health emergencies, intoxicated patients, suicide attempts, psychotic episodes, self-harm, and other related cases. I spend a lot of time on weekends and on overnight shifts in the emergency department. One day a patient from an adult group home came in. He had chronic obstructive pulmonary disease and had attempted suicide by overdosing on lithium. The overdose severely damaged his neurological system. He appeared to be in great pain but could not verbalize it. He could not stop moving and shaking, and was extremely confused and frightened. I was there to draw his blood while his lungs were being suctioned, and he was panicking, trying to pull the suction tube from his mouth and trying to remove his intravenous line. He had to be restrained. It was terrifying and heartbreaking to watch. I had another overdose case that stayed with me for a long time. She was very young, and no one knew what she had taken because she had not been found right away. A family member had called for a welfare check hours after the ingestion. She was awake but could not speak despite trying to do so. I was there for about 20 minutes while they worked on her and I waited to draw blood, and then for another 10 to 15 minutes when I returned. During that time, her condition deteriorated rapidly. Bruises began appearing all over her body and her limbs started turning purple. They placed a urinary catheter and her urine changed from normal to frank blood. It looked as if her kidneys or liver were failing rapidly. They tried to sedate her, but the medication did not work. Her body was shaking uncontrollably, as if she had neurological damage, and she kept trying to tell everyone something but could not form words. She looked terrified. When I received the blood sample, the flow and appearance were unlike anything I had ever seen. They had to intubate her despite the sedation not taking effect, and I can only imagine how frightening and painful that must have been for her. The only clearly audible words she managed were the pained phrase, "Oh my God." The experience gave me nightmares for weeks, and I broke down crying on the drive home later that day. Story 3. On Christmas Eve night in the emergency department. Emergency medical services responded with 2 school-age burn victims. They arrived with 7-year-old twins who had fallen asleep under the Christmas tree while waiting for Santa. The tree caught fire. Resuscitation was futile. Their pajamas had melted into the little remaining flesh. I can still hear the mother's scream of despair and grief. That was 17 years ago, and I think about them every year. Story 4. When I worked in the intensive care unit in my 20s, there was a 32-year-old mother of 3 with bone cancer she had been fighting for a while. She was dying, so she went to Mexico for an experimental treatment that did nothing, and she returned worse. Her family was very religious and continually pressured her to keep fighting, saying it would be sinful to give up and that her daughters would think she had not done everything to stay with them. She was in so much pain that the amount of narcotics she took in an hour would have killed me if I had taken that amount in a day. The cancer was so advanced that you could feel the tumors when you touched her, and her skin sometimes broke open and bled. She was in and out of the unit for about a year, while her husband and parents urged her to continue futile treatment. She was alone with us most of the time in horrible pain, while her family visited between living their lives. She was offered support to talk with her family if she wanted to change her mind about her care, but she did not want to go against them. Her husband had flown to another state for a religious conference, and her parents were out of town with her children when she began to die. The family tried to get home in time, but she died with only the nurses at her side. When I turned 33, I thought about how I was older than she ever got to be. I am in my 40s now and still think of her. The way she died was cruel, and it did not have to be. Story 5. I am a dentist, not a medical doctor. A patient presented with swelling and pain in the lower jaw in an area with no teeth. I examined him, made an incision, drained the pus, prescribed antibiotics, and ordered an orthopantomogram. There was an impacted wisdom tooth. We extracted it and everything seemed fine. 9 days later he called me. He was still bleeding and had heard a pop. It turned out he had fractured his mandible. We obtained a cone beam computed tomography scan, and something seemed suspicious. We performed a biopsy which revealed a tumor metastatic from his lungs, according to the physicians. His whole body showed widespread uptake on the positron emission tomography scan. I guess he has a few months to live. I feel bad. There was nothing I could have done, but being involved in the process was very stressful. This happened last month, so it is still quite fresh. Story 6. A patient came to my emergency department with an eye infection. He was a hermit who lived under a bridge and was unable to give a reliable history. He said it had been leaking pus for a while. I asked him to remove his homemade bandage and discovered a probable squamous cell carcinoma. It had destroyed all of the soft tissue of the eyelids. I was looking at the shriveled grape of his deflated globe sitting on the bare, eroded, necrotic bones of the orbit. Story 7. As a nurse, I had too many to count, but these were the worst. 1. A 2-year-old who had been beaten within an inch of their life and dumped by someone who ran away afterward and provided no information. The child survived but suffered catastrophic, life-altering brain injury. 2. A 16-year-old with fatigue while studying for exams who was found to have liver cancer that had metastasized to the bones and lungs. They died 3 weeks later, terrified during the process. 3. A spontaneous second trimester miscarriage in the toilet while I was in there with her. 4. A voluntary assisted dying patient I cared for as a new graduate nurse. I looked after them for 6 weeks before they chose to take the medication. Story 8. I cared for a patient for 11 months. His cancer eventually spread. He stayed in the same room and bed for the entire time. I was his nurse 3 or 4 days a week and got to know him, his wife, and his children. He died one day at about 10 a.m. His wife and I spent 2 hours packing up everything he had accumulated in that room. Housekeeping then took an hour to clean it. An hour before my shift ended, I admitted a new patient into that room. That day, I finally understood what happens after we die. We clean the bed and admit a new patient. Story 9. A 70-something-year-old patient had a craniotomy, in which a portion of the skull was removed to relieve pressure on the brain after an intracranial hemorrhage. Sometimes the bone flap must be left out for an extended period to allow swelling to subside. Patients usually wear helmets because the brain is essentially exposed beneath the skin, without bone, until the bone is replaced. This patient disagreed with their doctor and chose not to return to the hospital to have the bone replaced for 4 years. They lived 4 years without part of their skull. When they finally returned, it was too late. There was excessive infection and damage to the remaining skin and bone, and no surgeon would operate. In short, listen to your neurosurgeons. Story 10. I was a nurse at an assisted living facility during the coronavirus disease 2019 lockdown. We had the whole place locked down for over 2 years. No family or visitors were allowed. One resident in particular was a ray of sunshine, adored by staff and other residents. She had a mild intellectual disability and had lived in a group home most of her life, mainly for help with paying bills and applying for jobs. She was probably the youngest resident there, in her late 60s, and physically in great health. Her childlike innocence and humor kept the place upbeat. During the lockdown, she became absolutely miserable and cried a lot. Every day she asked when she would get to see her family. It was heartbreaking to tell her every time that it would be a while yet. She went through the entire lockdown without leaving to see her family, except for occasional medical appointments. The day the lockdown lifted, she was the happiest person I have ever seen. She could finally leave to see her family. She got dressed up for the first time since the lockdown started and made sure everyone in the facility knew she was going to have dinner with her family. We sent her off with a smile. The next day we learned that at the very dinner she had waited 2 years for, she choked and passed away. The facility felt lifeless for a while after that. Story 11. I am a prenatal genetic counselor, so this may not be what you were looking for, but I immediately thought of a case when I read the title and wanted to share. Due to the rare nature of the case, I cannot provide identifying details about myself or the patient. In the first year of my career, I saw a couple who were pregnant with their third child. They were the sweetest people and so excited. The first child was perfectly healthy. The second child died at less than 2 months of age from a severe autosomal recessive disease that caused immense suffering and never left the hospital. I saw them to test this baby to see if it had the same disease as their second child. We performed the procedure, cytogenetic testing was normal, and I finally received the molecular results for the family mutations a few weeks later. I called the mother by telephone to inform her that, unfortunately, the baby had the disease. I had never heard a human make the sounds that this woman made. She was heartbroken and devastated. And then the line went dead as if she had dropped the phone. I spent the next hour calling the patient, her husband, and the referring provider office until I reached her husband and confirmed she was safe. I saw them in person the following week and coordinated the termination of this very much wanted pregnancy. The experience was traumatic for both of us, and I wish we did not have to give initial results by telephone. I always call with these types of results before the follow-up visit because I would rather they hear it from me than read it in their patient portal on their own. I saw them a year later for their fourth and final pregnancy. We repeated the testing and, this time, I was able to give them the good news that their baby was healthy. It was surreal because I was also pregnant at the time at a similar gestational age. We continued our pregnancies together, as she was followed as high risk for other reasons, and I would pass her in the hallway every few weeks and catch up. We delivered 3 days apart. I still think about her and wish her well. Story 12. I was a labor and delivery nurse. I was called to the emergency room urgently. A wealthy man was driving his laboring wife to the hospital in a Porsche, traveling at least 100 miles per hour, when his car collided with a semi-truck. The woman was killed on impact. The baby survived but was in serious distress. An emergency cesarean section performed in the emergency room saved the infant, but the child suffered severe impairments due to hypoxia. The worst part came after the woman's autopsy. She was dilated to 2 centimeters, so he had time to get her to the hospital if he had been driving normally. Story 13. When I was in residency, I went down to the emergency department for a trauma to intubate a young man who had been hit by a car. He was in his early 20s, a motorcyclist and the victim of a hit and run. He had a severe head injury, was posturing with irregular gasping respirations, and was bleeding internally, so blood sputtered from his mouth every time he exhaled. I was at the head of the bed holding his cervical spine while the team performed the initial assessment, and then we intubated him. Because of my position, I was covered in blood from his breathing, and I can still picture his face vividly. I saw a lot of trauma, so that alone might not have affected me, but as I was heading back upstairs from the trauma bay, I thought he probably had a Facebook account based on his age. This was a few years ago. I found him easily. His profile picture was him with his girlfriend and his family, and I realized that none of them probably knew what had happened to him yet. He died later that night. Story 14. Neonatal Intensive Care Unit Nurse. 22 weeks is the age of viability in many places, and some centers have attempted resuscitation at 21 weeks with occasional success. This infant was a couple of days old and born at 23 weeks. He was stable, without intravenous drips, intubated and on a special ventilator for micro-preterm infants. When I received report, his oxygen saturation was slightly out of range. Time of death was called exactly 10 hours later. The infant developed overwhelming sepsis and did not respond to vasopressors, fluids, antibiotics, or other supportive measures. I had heard from experienced nurses about fulminant neonatal sepsis, but I had not seen it until then. We arranged for the baby to be baptized at the family's request about 15 minutes before his death, even though we were still providing full resuscitative efforts. After we called time of death, I broke down and placed the infant in the mother's arms to spend the last moments together. I stepped away briefly to regain my composure, thanks to my coworkers who covered for me. I returned and cried again when I saw him alone in the incubator. I played lullabies, dressed him in a tiny crochet blanket and hat, and took him to a private room with his parents. I will never forget this child. He was the only patient who died while assigned to me for an entire shift. For months afterward, I struggled with anxiety whenever I cared for patients with low oxygen levels or low blood pressure because I came to the cruel realization that sometimes your best is not enough. Story 15. My intensive care unit patient was declared brain dead, and we were waiting for the rest of her family to arrive so we could extubate. Every time her husband came to her side, she lifted her hands off the bed in an unusual way that did not match typical posturing. I could not reproduce the response when I tried, and I had a terrible feeling about him. Later, I learned he was charged with murder. Story 16. I am an operating room nurse. A 20-year-old woman came in with a ruptured spleen. She was a Jehovah's Witness, and she and her family refused blood transfusions. The surgeon worked hard to repair her spleen before she lost more blood. They infused so much normal, saline and lactated ringer solution that eventually the bleeding appeared to stop and the abdomen contained only fluid. It was devastating to watch her die before my eyes, knowing she could have been saved. This was 20 years ago, and I think about it all the time. Story 17. A 16-year-old girl came into the clinic with her mother, complaining of persistent, mild asthma. The symptoms and pulmonary function tests did not match asthma. Blood tests revealed advanced lymphoma. This was probably more than 20 years ago. I still think about that poor girl. Story 18. I trained in medicine in India about 25 years ago. As final-year trainees, we observed hydrophobia in a 17-year-old male patient with irreversible rabies. The consultant stepped out and told the mother to take him home. Her son would die in 72 hours and nothing could be done. I will never forget her agonized cry of shock and anguish. Story 19. I have a few that haunt me in horrible ways. Here is one that haunts me in a laughing out loud. What the heck way? An older woman came in with a general complaint of illness. A nurse seated her and began asking questions. The woman said, "Well, I have branches growing out of me down there." There was a long silence. The nurse asked clarifying questions and had to type into the medical record that the chief complaint was branches growing out of her vagina. My friend, the nurse practitioner, examined her and discovered that the woman had a vaginal prolapse several weeks earlier. One of her neighbors, upon hearing of her problem, suggested stuffing potatoes into the prolapse as a folk remedy. The potatoes remained there for weeks in a dark, damp place and began sprouting, which explained the branches. The potatoes were removed. She was given a non-potato treatment for the vaginal prolapse and advised not to stuff potatoes into her genital area again. Story 20. A man survived a suicide attempt and is now permanently incapacitated. I don't know what his quality of life is like. Story 21. I am a nurse. I work in hospice care. It can be very hard sometimes, but I mostly love it. There are two patients I will never forget. The first was a 29-year-old woman with breast cancer that had metastasized. She had several young children, and at the time I was 2 years younger than she was. I got to know her well and helped her prepare her children for what was happening. I was an emotional wreck each day. In her last few days, she was terrified. I ended up staying with her 8 hours a day to help manage her anxiety and pain. On the last day, she was so calm that I was able to leave the house earlier. I felt guilty because her case was really affecting me mentally, so I wanted to leave to get a mental break. I had only been gone for an hour when I received a call from her mother. I will never forget the sounds I heard. The patient was screaming that she did not want to go yet, and her mother was begging me to come back. I rushed back to the house, but she passed before I arrived. She looked so scared. This one hurt me the most because my job is to make death peaceful and dignified. Her family watched her scream and thrash as she took her last breaths. I will never forget it. The second was an absolutely sweet patient. He had cerebral palsy and significant developmental delays. He did not have a full-time caregiver, but we were working with social workers to arrange more in-home support. He was thriving with the new caregivers and was possibly going to be discharged from hospice because he was no longer declining. I remember receiving a call from his new caregiver saying that when she arrived, that morning he had died. It was most likely a stroke. When I arrived to complete the death pronouncement and postmortem care, he looked unusual. His skin felt different. When I turned his body to bathe the back, layers of skin separated and remained on the bed, from the back of his head down to the backs of his feet. I cannot get the image of his denuded back out of my head. I have never seen that before or since. I have many more memories from my intensive care unit days and my labor and delivery days, but those two stick with me the most. Story 22, Trauma Nurse here. The case that has been giving me nightmares lately feels like Final Destination. I have a lot of other things burned into my mind, but this is fresh. I do not share the really bad details. A person was driving on the highway when a trailer hitch came through the windshield and struck the patient's skull. The patient survived but sustained a severe traumatic brain injury and a skull fracture. They developed meningitis and required reconstructive surgery. Story 23. I sat one-to-one with our retired psychiatrist, who had been admitted with dementia and altered mental status. Story 24. Sorry, I cannot provide graphic descriptions. Edited. Non-graphic version suitable for text-to-speech. A neglected person reportedly being cared for at home developed a severe pressure injury. The wound was advanced, with exposed underlying tissue and a strong odor. The person later died. Story 25. I am a cardiovascular technologist and work in the cardiac catheterization laboratory. At the time, I was a student. A woman in her 40s or 50s came in for a routine cardiac catheterization. She was very nervous and told us about her plans to have dinner with her children. The procedure started and everything was going well until she suddenly sat up and almost fell off the table, shouting that she did not want to continue. We were already inside her heart with catheters in her arteries, so we had to pull her back down and restrain her for her safety. About 30 seconds later, her heart stopped. We looked for a dissection or perforation from her coronary arteries to her aorta and found nothing. Everything appeared normal. She died and did not get to have dinner with her children. An autopsy was not performed, so the exact cause was never determined. Story 26. Two cases are tied together in the same family. A little girl, G, was unrestrained in the front seat of her mother's car when it crashed. Her mother was found to be at fault. G broke her neck and is paralyzed from the neck down. She has a tracheostomy, ventilator, feeding tube, and requires straight catheterization, yet remains alert, talks, learns, and grows. 2 years later, a boy, K, was unrestrained in the front seat of his mother's car when it crashed. His mother was found to be at fault. K broke his neck and is paralyzed from the neck down. He has a tracheostomy, ventilator, and feeding tube, and remains alert, talks, learns, and grows. These two mothers are sisters who live in the same town. I met the boy as an infant when I was caring for the girl. I am angry about the first tragedy and deeply disgusted by the second. Story 27. I cared for a woman who was a quadriplegic from an infection of her cervical spine and who had a tracheostomy. Her son was her conservator and he decided whether she would undergo any procedures and what her code status would be. Every day I cared for her, she would silently mouth, "Let me die," repeatedly. The son told us she did not know what she was saying, so we continued with invasive procedures, dialysis, and multiple surgeries. It was horrible, and I left for a desk job because of how awful I felt. I will never forget the look on her face mouthing those words. Story 28. There are so many. I work in obstetrics and gynecology. A relatively recent case involves a 35-year-old mother of two who was pregnant with her third. She had long-term reflux and vomiting and had an endoscopy the year before. When she became pregnant, the vomiting became so severe she could not eat and she was losing weight. Initially, it was treated as severe morning sickness. Then a scan found a thickening at the upper stomach sphincter. A biopsy showed cancer, a rare aggressive type. She had to choose whether to receive chemotherapy during pregnancy, risking an extremely premature birth and a very poor prognosis that would likely leave her husband with 2 children and an extremely premature infant. She chose to terminate the pregnancy. The kicker is that the endoscopy the year before had included a biopsy that showed cancer, but no one followed up the result. Story 29. Not a doctor. I work in mental health, and before my current job I worked on an inpatient unit. Once a month we had a barbecue for patients and staff. It was usually a really fun day because it was different and broke up the monotony. I was in the patient kitchen handing out food with a few other staff when a patient came in to grab his juice from the refrigerator. He was not a big talker, possibly because of schizophrenia and autism, so when he did not say anything it was not unusual. Suddenly he began shuffling as if he had become stuck in the refrigerator. My colleagues went to help him maneuver out when he turned blue and collapsed. That is when we realized he was choking. I remember calling the emergency team and hitting my duress alarm. Our nurses and doctors responded quickly and did everything they could. But the food was too impacted and too far down his throat to be cleared. He died on the floor of our tiny kitchen where I used to bake cookies and cupcakes with patients. I had done a lot of work in supervision and therapy because I was having intrusive thoughts about witnessing someone self-harm or attempt suicide. I was not prepared to watch someone choke to death on a sausage in a bun. I think about his Nana, who visited most days even though she was 82. She had so much hope for his recovery after his recent decline. I learned he had a daughter who had never met him. He was only a couple of years older than me, not yet 40. Even though I am not a medical professional, the what-ifs haunted me for a while. Not an experience I am in a hurry to repeat. Story 30. When I was working in the intensive care unit, a woman in her 30s was brought in after being found unconscious by her children. Imaging showed a ruptured brain aneurysm, which led to an anoxic brain injury. She had no family in the country other than her children, the oldest of whom was only 11. The Department of Human Resources became involved, and a social worker and the hospital chaplain came to explain that their mother would not recover. Hearing those children scream for their mother, not knowing if they would stay together, stays with me. Story 31. I am a registered nurse. I worked on an oncology floor and received report on a comfort care patient who was actively dying. On assessment, he showed clear signs of distress, and I was surprised he did not have a continuous pain pump, as most comfort care patients did. As I was finishing the assessment with plans to contact the doctor for pain medication, he reached out to me, as if for a hug. I stayed with him briefly because I wanted to obtain pain relief as soon as possible. I did not think death was imminent. I expected to care for him throughout my shift. In the 30 minutes it took to find a provider and obtain orders, he died alone. This was over a decade ago, and I still wish I had stayed by his side, given him a hug, and ensured he did not die alone. Story 32. A 4-year-old was run over by a car. The child arrived alive, carried in his father's arms because the incident occurred 1 block from the hospital, but did not survive. Story 33. A 36-year-old woman with 4 children was dying of breast cancer. It was heartbreaking to see her in the hospital bed when her husband and children came to visit. The husband knew she was dying. The oldest child, who was 10, understood, but the younger children were too young to understand that their mother would not come home. Story 34. I lost many patients as a bedside nurse. Many are memorable, but none haunt me anymore. I now work in outpatient care, and I recently had a relatively young patient die because we could not get her inhalers or continuous positive airway pressure device covered by insurance, and she could not afford them. That one will stay with me for a while. She did not have to die. Story 35. I am a nurse. A man came in asking for something to stop his sweating. He said he had seen a doctor a few days earlier for a sore throat, had been diagnosed with streptococcal pharyngitis and given antibiotics, but he remained profusely sweaty and uncomfortable. He did not look well, his skin was pale and slightly gray in tone, and his vital signs were abnormal. We brought him back and ran blood tests. His white blood cell count was extraordinarily high, and the doctor suspected leukemia. We transferred him to a hospital with a higher level of care. A few hours later, we received word that he had gone into cardiac arrest and died. I was shocked because it happened so suddenly. He was not old, perhaps in his 40s. Story 36. I am an emergency room doctor. I once cared for a man in his 40s who was brought to the emergency department after suffering a cardiac arrest. According to emergency medical services, he was barbecuing in his backyard with his family when he suddenly collapsed. I performed resuscitation for over an hour without success. I had to tell his wife and young children that we could not bring him back. He had no known medical history. I am not sure what the cause was. The traumas and freak accidents do not really haunt me. It is the sudden, unexpected tragedies that do. Story 37. I was an internal medicine and pediatrics resident still in training, working a 24-hour shift in the pediatric intensive care unit. About 10 p.m. we received a 5-year-old who had been unattended for about 17 minutes and was found at the bottom of the family's in-ground pool. The child was resuscitated but died days later. I got home the next morning to find my wife and children swimming in the neighbor's pool. I was too tired and emotionally overwhelmed and just broke down. It still bothers me. That was 10 years ago. I will always remember the children who died, but that case affects me the most. Story 38. Nurse here. I have cared for many patients. I try to remember names, but sometimes they are just faces. A few stories. When I worked in labor and delivery, I had a patient planning to give her baby up for adoption. The adoptive parents were the sweetest, most excited people and had been chosen early in the pregnancy. They got to hold and bond with the baby for 36 hours. At the last minute, the birth mother changed her mind. The devastation and wail from the adoptive mother was heart-wrenching and still brings me to tears. The adoptive father packed their things, hesitated, left all the baby blankets and outfits, and mumbled, "This is the third time." The birth mother was just as miserable, clutching the baby and saying she could not do it. There was no villain in the situation, but everyone was hurting. In pediatrics, I have seen the gamut. Many cases of non-accidental trauma, a term for physical abuse, that leave children with severe injuries and brain damage. I have held children whose heads were twice as large as their bodies from fluid buildup. Their cries are hard to soothe because, as neurological patients, they can worsen with overstimulation. Instead of instinctively rocking or bouncing them, you have to hold still, turn the lights off, and make a humming noise that might soothe them. The worst case was on my floor for withdrawal of care, so the child could pass in the hospital rather than at home. The mother sat in the corner on her phone the whole time, and the grandmother was the only one caring for the child. He was probably around 6 months old. We were not giving food or water, so the grandmother applied lotion and lip balm while the child groaned and cried. Many nurses said the mother did not care. I cared for him for several days and caught the mother when the grandmother had left to shower. The mother heard him moaning, looked at me with a single tear in her eye, and said, "I want you to know that's not my baby. My baby is at home, and he is happy and waiting for me. They keep telling me that's my baby. My baby is okay." Full denial, even as her body betrayed her. Her lip quivered and the tears rolled. Turned out she was looking at baby pictures on her phone. She had been dating a man for 2 months, left to go to the grocery store, and the man had severely injured this child for crying. She blamed herself. The child lasted far too long and was moved to a high-acuity short-term care facility. That was brutal. I hope she is somewhere now, forgiving herself and allowing herself to grieve. On a happier note, one of my favorite patients who has since died was severely developmentally delayed but had the sweetest disposition. She loved Elmo but could not actually watch Sesame Street because she would get so excited that she would have seizures and require rescue medication. She would clap when I entered the room and loved to stroke my cheek. I miss her. I have posted longer stories elsewhere, but they are too long to include here. Know that nurses love their patients, and we try so hard to fight against death. We see them behind our eyelids, and we have the privilege of being with the most vulnerable people in the worst time of their lives. It is an honor and a curse. Story 39. During the COVID-19 pandemic, I had a patient in the intensive care unit with very severe pneumonia not caused by COVID-19. She needed extracorporeal membrane oxygenation, but our hospital could not support it at the time, and all other hospitals were too full to accept a transfer. We did everything we could for her, but on my first assessment one day I found her pupil was fixed and dilated. An immediate computed tomography scan showed a massive stroke. I was in my early 30s and she was exactly 1 month younger than me. I remember watching her husband and mother come to the bedside and cry over her, and suddenly I saw myself in the bed and my husband and mother in the room. They made the decision to transition to comfort care, and I watched her die. I will never forget her. She was one of the victims of the pandemic who never contracted the disease. Story 40. We had a patient in his 20s who overdosed. He thought he was using Norco, but it contained fentanyl. He was found unresponsive with no oxygen to his brain, so he was essentially dead. His parents came to the bedside. There was tension between the mother and the father. The father had accepted his son's death, and the mother said, "I want a second opinion." I felt obligated to ask, "Does his father want this?" The mother went out to the waiting room and told the father. The father ran into the unit, screaming, "I will not have her parade our son's dead body around this county, so she can feel better about what she did to him." The father revealed that the mother had attempted to sell their son on the internet for drugs when he was a child. She drugged him with Benadryl. The Federal Bureau of Investigation was involved, and she was incarcerated for most of the boy's life. When she got out, she continued drug use and influenced her son to start using. Later, the father said he looked through the boy's phone and found that a drug dealer's location was shared on the phone. He asked me whether I would report the dealer to the police. I said yes. That dealer could kill other people's children. It was heartbreaking. The patient was an organ donor and he saved 3 lives. Story 41. I am a nurse. I had a patient who fell and landed chest down on a fence, sustaining multiple rib fractures and a sternal fracture. They had constant chest pain from their injuries and were scheduled for discharge the next day. They complained about the chest pain overnight, but it was not new for them. They had been receiving narcotics because the pain had been ongoing and at times severe. They also mentioned feeling anxious and restless overnight and could not sleep. Anxiety was not new for them, according to my report. I did my last round at 6:30 a.m., and they were finally asleep. I remember thinking how peaceful they looked and quietly left the room. By 8 a.m., after I had left my shift, they went into cardiac arrest, and it was a prolonged resuscitation. Chest tubes were placed, we lost intravenous access during the resuscitation, and multiple intraosseous lines were inserted. I woke up to return to work and someone had texted me. A young person with children was gone like that. I felt the guilt of knowing I was the last one to spend 12 hours with them. It makes me wonder whether investigating their anxiety more or questioning their chest pain more thoroughly would have made a difference. I do not know. Story 42. A homeless man was wheeled in with a blanket covering his legs. The monitor flatlined, so a registered nurse began chest compressions while another removed the blanket. Maggots were on his decaying legs. The team continued cardiopulmonary resuscitation as maggots flew through the air. Afterward, we kept finding maggots in the room vents for days. Story 43. An 18-year-old woman, 31 weeks pregnant, came in one night with heavy bleeding from a massive placental abruption. We rushed her to the operating theater for an emergency cesarean section, but the baby died before delivery. I remember asking her if we could call someone to be with her before the anesthetist administered general anesthesia. She said her boyfriend was not involved and her mother did not know she was pregnant. After she regained consciousness, I asked again. She still declined. She remained in the hospital for a few days until we were certain she was well enough for discharge. She saw her baby and signed the forms to arrange a hospital burial, then went home as though nothing had happened. I cannot imagine how she processed the events and handled all the decisions and paperwork alone. I was 24 at the time and felt ill-equipped professionally. I still think about her and her baby often. Story 44. A single mother of 3 teenagers died suddenly from an aneurysm. She was in the intensive care unit before being declared brain dead and removed from life support. The father could not be located. The oldest child, not old enough to drive, helped us clean their mother's body before the siblings came to see her. The 3 of them crawled into bed with her and held her, crying, as she passed. Then they were separated and placed in foster care. I remember them trying to hold on to one another as they were torn apart. The only other family were some 90-year-old aunts who could not take them. Several months later, we heard the father had been found in another state and agreed to take them, even though he had never met the youngest and the oldest had barely any memory of him. At least they could be together. I think of them often and how that day changed their lives. I hope they turned out okay. It has been about 20 years. Story 45. Newborn with multiple chromosomal abnormalities incompatible with life received palliative care and lived just short of 2 weeks. It was very sad. What stays with me is that the baby's mother was a 15-year-old girl who had been sexually assaulted and impregnated by her father. It was a tragic situation. Story 46. I am a nurse. This was at the height of the coronavirus disease 2019 COVID-19 pandemic. I was pulled to my hospital's medical ward, where all but 2 patients were on respiratory isolation. I had a 9-patient assignment, all on isolation, requiring gown, gloves, and mask to enter the room and careful removal to avoid contamination. We were still trying to administer our 8 a.m. medications at noon. There was a gentleman in severe distress who did not want an intensive care unit transfer or heroic measures. He kept pulling off his gown and oxygen mask and looked panicked. I repeatedly tried to enter and give him sedation and medication as often as I could. Could not find any staff or family to sit with him. I was administering medications again when the roommate called that he had fallen. In his panic, he had launched himself out of bed. The nursing aide and I went into the room, and he had died by the time we reached him. I somehow got through the rest of my shift. I have been a nurse for 33 years in a variety of clinical areas and have even dealt with fetal demise and stillbirths, but this was the first death after which I had to take my next 2 shifts off. I could not stop crying, and had to seek help and counseling from my employee assistance program. I understood what moral injury really means. I was heartbroken that I could not be there enough for him, and it took a long time before I could think of this case without tears in my eyes. I am now in a different area of nursing, outpatient chemotherapy, but that entire shift and the COVID-19 pandemic were the final straw that made me leave hospital ward nursing. Story 47. I am a psychologist with a Doctor of Psychology degree. During my residency, we had a frequent patient on the ward. She was admitted about every few weeks on average. She had severe paranoid delusions. Medication would help, but she would stop taking it. It was a vicious cycle, to be honest. In my opinion, she needed full-time hospitalization, but that decision was not mine. Toward the end of my residency, I realized I had not seen her on the ward in a few months. So I asked the nurses about her. It turned out her delusions had worsened and she had stabbed her mother and younger sister before harming herself. Both survived, but she died from her self-inflicted injuries. I have always felt that if I had pushed harder for her to be committed, I might have saved her and avoided the attack on her mother and sister. I know I was only a resident and not the decision-maker, but I feel I should have pushed harder. I am humbled by the attention this has received and fascinated by how the discussion in the comments will develop. Story 48. Nurse. I'm assuming you want bad cases, so here we go. I'm on orientation for the intensive care unit. We had 2 patients, one of whom was going to be transferred out because she was doing better. We got a call that a new patient was coming and they were still actively coding the patient, still giving arrhythmia medication pushes and seeing possible asystole on the monitor. My preceptor said, "Okay, you have these 2 patients. I trust you. I'll handle this very unstable patient, and we will stay next to each other if you need anything. I checked my monitor and saw my patient, the transfer, now had 2 pacer spikes per beat, whereas before the patient had only 1. I went into the room to check on the patient. The patient was unresponsive. I applied painful stimulus and yelled the patient's name. The patient did not wake. I looked up and heard alarms blaring. The monitor showed no heartbeats, only pacer spikes. The pacing failed to restore her cardiac rhythm, and because I had checked, I was able to immediately start chest compressions. At the same time, the crashing patient arrived, who was now also in his systole. The doctor was upset and said, "I cannot be in both codes." So an emergency department doctor arrived and ran the code. The patient died. We had no idea what caused it. It still lingers in my mind years later, so I always tell my coworkers a bit about my patients so they know, in case I am busy, what is happening and can hopefully catch something. I warn new nurses too that bad things happen. There is nothing you can do but try your best. Story 49. When I was on a nursing placement, there was a man who had worked hard his entire life. 2 months after retiring, he was diagnosed with cancer and admitted to the hospital due to complications. He contracted the coronavirus in the hospital and died shortly afterward. Story 50. My first pediatric resuscitation involved a child brought in unresponsive by emergency medical services. The child had been vomiting for days. The parents had tried to hydrate them and thought it would be okay. We were able to revive the child and transfer them to a children's hospital. But the child died within 24 hours. It was tragic. The most recent case was several years ago. An elderly patient brought in unresponsive by emergency medical services. The patient had been abandoned by their caregivers and was covered in dried fecal matter. They were so dirty that their clothing had begun to fuse to the skin. We had to cut it away carefully. When we turned the patient, we found a pressure wound forming where a metal can had been under them, and they had been unable to move off it. 3 of us cried as we tried to clean and help them. I do not know whether they survived. When I started working in healthcare, no one prepared me for how many patients I would care for who had been abandoned by their caregivers. When students ask me what I was not ready for, I tell them that many people have told me to my face that they are abandoning a family member because they cannot care for them or do not want to deal with it. It does not have to be this way, but the process is painstaking, takes a long time, and there is a massive lack of knowledge about how to obtain long-term care. I know everyone's situation is different, and I am not saying everyone can arrange care. The system is difficult to navigate, and I find people's frustration understandable. That does not mean I find abandonment acceptable. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.